Most medical emergencies don't look like the movies. They aren't dramatic, they aren't rare, they aren't extreme. They're cuts that won't stop bleeding, burns from cooking without power, fevers that won't come down, infections that start small and get worse. And when you can't get to a medical facility right away, the difference between calm and chaos is basic medical readiness, not advanced gear. In this video, I'm going to walk through medical and first aid preparedness that actually makes sense, focusing on the most common problems people face, the supplies you will realistically use, and the skills that matter when help is delayed. This isn't about becoming a medic. It's about keeping small problems from becoming big ones. One of the biggest mistakes people make with medical preparedness is planning for rare trauma instead of common problems. They buy advanced tools they don't know how to use. They stock items they've never practiced with. They prepare for situations they statistically won't face. Meanwhile, they're missing basics like wound cleaning, infection control, fever management, hydration, and gastrointestinal care. Preparedness works best when it matches reality. If medical care is delayed, the most common issues you are likely to deal with are not extreme injuries. They are things like cuts and scrapes, burns, sprains and strains, fevers and infections, allergic reactions, stomach illness, dehydration, headaches and body pain, stress and anxiety responses. These problems are boring. They are also the ones that cause the most suffering when ignored. Your medical supplies should start with a simple foundation. You should be able to treat bleeding, minor burns, wounds, pain, and illness symptoms without hesitation. That means having adhesive bandages in multiple sizes, gauze pads and rolls, medical tape, antiseptic wipes or solution, antibiotic ointment, burn gel or burn dressings, elastic wrap for sprains, disposable gloves, tweezers and scissors, a reliable thermometer. If you don't know how to use something confidently, it doesn't belong in your primary kit. The single most important medical skill you can have is proper wound cleaning. Infection is the real enemy. Not pain, not blood. Infection. Basic wound care looks like this. Clean your hands. Rinse the wound with clean water. Remove visible debris gently. Disinfect carefully. Cover appropriately. Monitor daily. Most wound infections happen because wounds weren't cleaned well enough, not because someone lacked advanced equipment. Clean water and antiseptics matter more than fancy tools. Burns are another common issue during outages. Open flames, candles, camp stoves, and hot cookware increase risk. If a burn happens, cool it immediately with clean water. Do not apply grease or oils. Cover loosely with a clean dressing. Watch closely for signs of infection. You don't need specialized trauma burn kits for most situations. You need calm response and cleanliness. Medications are where medical preparedness truly shines. They manage pain. They reduce fever. They control symptoms. They prevent small issues from becoming emergencies. And the best part is, these are medications people already know how to use. Pain and fever management are non-negotiable. Pain drains energy. Fever increases dehydration. Both make stress worse. You should have multiple options available because not everyone tolerates the same medication well. Common choices include acetaminophen for pain and fever, ibuprofen for pain and inflammation, and aspirin for adults where appropriate. No proper dosing, never exceed daily limits. Understand stomach and liver risks. Pain control keeps people functional. Function matters. Allergy and reaction medications are extremely important. Allergic reactions don't stop during emergencies. At a minimum, stock antihistamines you already tolerate well, both non-drowsy options and faster-acting options for reactions. These help manage insect bites, food reactions, skin irritation, and environmental allergies. Even mild reactions become stressful when medical help isn't readily available. Gastrointestinal medications are among the most used during disruptions. Changes in water quality, food, stress, and hygiene increase stomach issues quickly. You should have medications for diarrhea, nausea, acid reflux, and gas. Stomach illness dehydrates people fast. Dehydration turns minor illness into a serious problem. Cold, flu, and respiratory symptoms don't stop just because the power's out. Have medications for congestion, cough, sore throat, and fever reduction. You don't need every brand on the shelf. You need medications your household already uses and tolerates. Stress and cold environments make respiratory symptoms worse. Electrolytes and rehydration solutions are medical tools, not comfort items. They help manage vomiting, diarrhea, fever, heat stress, and physical exhaustion. Store powdered electrolyte mixes or oral rehydration salts. Water alone is not always enough. Topical medications matter more than people think. Skin issues escalate quickly when hygiene is disrupted. Have antibiotic ointment, antifungal cream, hydrocortisone for inflammation, and barrier creams. Skin infections are common, painful, and often preventable. Eye, ear, and oral care are often overlooked. Consider saline eye rinse, artificial tears, oral pain relief gels, and temporary dental repair kits. Dental pain becomes unbearable fast, and it's hard to ignore. If you have children, medical preparedness deserves extra attention. Children dehydrate faster, they get sick faster, they panic faster. Stock child-safe medications, proper dosing tools, electrolyte solutions, and comfort items. Preparedness reduces panic for them and for you. Prescription medications are critical. If you rely on prescriptions, this is non-negotiable. Talk to your doctor early. Many doctors will approve an extra 30-day supply and sometimes a 90-day supply, especially when approached calmly about emergency preparedness. This is about continuity of care, not stockpiling. Store prescriptions properly, clearly labeled, and rotated just like food. Medical training matters, but it needs to be realistic and legal. You do not need to perform advanced medical procedures. You do need basic skills. Highly recommended training includes CPR, basic first aid certification, wound cleaning, recognizing infection, dehydration, and fever danger signs. Training builds confidence. Confidence prevents mistakes. Learning about wound closure is useful, but attempting stitches without proper training increases risk. Better options for most people include steri strips, butterfly closures, and proper bandaging. The goal is protection and monitoring, not surgery. One of the most important medical skills is knowing when something is getting worse. Warning signs include fever that won't come down, increasing redness or swelling, red streaking from wounds, confusion, difficulty breathing, or severe pain. Preparedness includes knowing your limits. Imagine a household with no medical prep. A small cut is ignored, it becomes infected. Supplies are limited. Help isn't immediately available. Stress rises quickly, not because of injury, but because options are gone. Now imagine a household with calm, basic medical readiness. Symptoms are managed, wounds are cleaned, hydration is maintained. Recovery happens at home. That difference matters. Medical supplies should be easy to access, clearly labeled and centralized. You should be able to find what you need under stress. Medical chaos causes mistakes. Medical preparedness is not about extreme scenarios. It's about clean wounds, controlled pain, managed illness, continued medication, and calm decision-making. If you can handle common problems well, you reduce risk dramatically. When help is delayed, you don't need to be a medical professional. You need to be prepared enough to buy time safely. That's what medical preparedness really is. Steady days aren't built with dramatic interventions. They're built with simple skills, realistic supplies, and confidence in what you can actually do.